Good afternoon, everyone. This is Dr. Wells with Nutritional Physical Therapy. I'm here with a research update, and I'm excited because CSM is coming up, and I hope you're going to be there because I plan to be there. And if you are, shoot me a message, and maybe we can connect for a nice coffee or a Mediterranean meal. Anyhow, this research update today is by Bai et al. It's BAI in the Journal of Alzheimer's Disease Reports. The title was Cognitive Function After Stopping Folic Acid and DHA Intervention, an extended follow-up results from a randomized, double-blind, placebo-controlled trial in older adults with mild cognitive impairment. It's a mouthful, but we as physical therapists and healthcare providers, we deal with MCI, or mild cognitive impairment, quite a bit. I know in my practice I deal with it a lot, and we focus a lot on lifestyle interventions, sleep, exercise, diet. These are huge. So very exciting to see this new publication come out. And the prior randomized control trial they published on mild cognitive impairment showed some improvements in supplementation with folic acid. So that could be promising. And sure enough, from this study, they found that supplementing with both folic acid and DHA improved parameters of mild cognitive impairment. Now, it should be noted that both groups that were followed in the study, those that were on the placebo and those that were on the actual supplement intervention, had cognitive decline over the 6-month period of the intervention, or placebo intervention, right? Well, what's notable is that those that were taking the folic acid and the DHA had a significantly less decline in their overall cognitive functioning. And so what they found also, what I thought was interesting, is their serum amyloid beta peptide, which is a marker of possibly cognitive impairment, right? So we see those are sometimes increased in those that have Alzheimer's and other types of dementia. And homocysteine were also decreased when they had this folic acid and DHA intervention on board. Now, is this surprising? Probably not. Like, we know that DHA is very good for the brain. We always talk about that, and we highlight this on our courses quite a bit. Omega-3s, in particular EPA, tends to be very cardioprotective, whereas DHA tends to be more brain protective. So not a significant surprise with that. Now, the folic acid definitely seems more surprising and more sort of interesting. And the notion that homocysteine's gone down also could be related to that folic acid, possibly reducing some of that background inflammation. So interestingly enough, 6 months after those individuals started the supplementation, their brains and their decline went pretty much back to where they would expect it to be. So in other words, the authors suggest that maybe this folic acid and DHA supplementation has some teeth, some legs in it. We obviously need more research, particularly for those with Alzheimer's. We need more information on this, but this could be something that we as physical therapists and neuro-inclined rehab specialists should be keeping an eye on for those that have mild cognitive impairment. Overall, the risk of supplementing with DHA is pretty low, and it's pretty common within a lot of individuals taking fish supplements, for instance. Folic acid, we know there's really strong evidence for it for those that for prenatal vitamins and for those that are pregnant. So the overall risk with that supplement is also fairly low too. I'm not huge in supplementation for the most part, but this is definitely promising, and hopefully we'll see more from it. Anyhow, if you like this content, like, subscribe. CSM's coming up, like I mentioned. If you like nutrition, there will be nutrition content there, but nothing like our three-part course series. So check that out. Sign up today. Have a great one.